Welcome to the first series of many to come webinars that the Mid-Missouri Black Nurses Association is putting together with the support of Boone Hospital and Stevens College, the new School of Nursing at Stevens College. We, the Mid-Missouri Black Nurses Association, are the 171 chapter of the National Black Nurses Association. And our mission is to provide a forum to foster unification among minority nurses of various age groups and educational levels to ensure collaboration that result in improvements in patient care, our community, and our profession. And we are all here tonight because of the welfare of our community. We want a healthy community. That is why we are organizing this webinar to educate people about the importance of getting the COVID-19 vaccination. And we don't want to leave anyone behind. So in this series, the first of many to come, we have 4 panelists tonight, and I will go on and introduce you to our panelists. But before I do, I would like to let you know that we have Q&A, question and answer forum, whereby you can send in your questions that you need answered so that we can address them, which is the purpose of this webinar. We want to allay your fears and anxiety and to dispel the mistrust that we, the colored people or Black and brown folks, have of the healthcare system and the healthcare workers. I want to let you know and assure you that this is not a forum to convince anyone to get the vaccine, but to give you good information that will help you to make an informed decision for your life, for your health, for your loved ones, and for the community, for the good of the community. After I introduce the panelists, I will give them a chance to share why this topic is dear and passionate to them and what they have seen as the front line workers in this pandemic. We want to use this opportunity to let you also know that at the end, there will be a poll to ask if this webinar is useful or if you've learned anything or we have answered your questions. It's a simple yes or no answer at the end, and we'll show what the result is. And during the course of this webinar, we want to make it clear that we respect all groups, all races, all ethnicity, and we welcome diversity in our group because together we stand and divided we fall. So without much ado, I will introduce the panelists. I will allow me to introduce Dr. Osaze Edo-Ohonba. He is a nephrologist and critical care doctor at Boone Hospital and takes care of COVID patients in the ICU. And we have Dr. Kate Grossman, who is a pulmonologist and a critical care doctor. She also sees patients with lung problems in the clinic and cares for multiple COVID patients in the ICU at Boone Hospital. We have 2 nurse practitioners who have seen it all in the ICU. To my left is Michelle Gay, a certified acute care nurse practitioner, and Seveny Grieve, a certified acute care nurse practitioner also. They both work at the ICU and have taken care of COVID patients in the ICU, and they have seen the effect and the devastating ways that this disease has touched patients and their families and loved ones. So I will let them speak now, beginning with Dr. Edo-Ohonba, to share what he knows and how he is passionate and what brought him here today as the front line workers during this pandemic. Thank you all for being here tonight.
Good evening, everyone. Thank you for having me here tonight. I work at Boone Hospital, and I had the privilege to take care of several patients who were infected with this dreaded disease. To say that the last 1 year has been a challenging and difficult time for many people is just an understatement. We have to find a way to end this plague. You know, I saw it as a plague, and unfortunately, this disease was very disproportionate in the number of people who were of African origin, African Americans, compared to the percentage of people in the population. You know, it not only infected them more, you know, but the consequences of those who died, they also bore more of the burden as well. And I think that we, as healthcare professionals, we owe our people and everyone a duty to inform and to educate people about what we can do as a community to stem the tide of further death. And I know that there are a lot of fears and a lot of questions. And my hope is that at the end of this evening, all our fears and questions will be thoroughly explored and answered, so that going forward, we all will be able to make good decisions as to what to do, so that we don't continue in this difficult situation that we found ourselves. There is hope, and there's light at the end of the tunnel. And I'm glad that I'm here tonight. And thank you for having me.
Thank you, Dr. Edo-Ohonba. Now I will turn the floor over to Dr. Grossman to share why she's passionate about this topic.
All right, my name is Kate Grossman. I'm a pulmonary and critical care physician at Boone Hospital. I'm so excited to be here tonight, and thank you very much for the invitation. I take care of patients in the ICU, and I also take care of patients in the pulmonary clinic. So I've seen this pandemic from a couple of different lenses. From the lens of an ICU doctor who's cared for numerous incredibly sick patients and their families. From a pulmonary doctor who is now seeing numerous patients in the clinic who are dealing with the after effects of this disease. So even if they weren't critically ill beforehand, and even if they had a mild course, I'm seeing patients who have now been symptomatic for months afterwards and dealing with serious repercussions ongoing that we really don't have a great handle of how to treat and how to manage. I've seen this through the eyes of a family member, having had my brother-in-law very early on in the pandemic be in the ICU and on a ventilator in New Orleans. And, you know, I see on a regular basis disparities in healthcare. And I think that it's our duty as healthcare providers to fight against these disparities in every way that we can. And I think the most important thing that we can be doing right now is educating the public about the vaccine, about this disease, and doing everything we can to bring equity to our system and to make sure our patients are taken care of in the best way that we can.
Thank you, Dr. Grossman. Michelle, do you have anything to add to that?
I feel that they really touched on just the impact that COVID has had on our patient population. And I just want to touch on the fact that this pandemic has not only caused illness and death, but it's affected the whole country and whole world, rather. in many other ways. And so while it's important for us to get control of the virus and keep people well, it's also important for us to be able to get past this, because there's other effects that have nothing to do with even the illness itself, but the impact on people in other ways and on their lives and their family connections and things like that. And so I just think that in general, it's really important to talk about how and the importance of doing what we can to get to the other side of this.
Okay,
Yeah.
before I get to Seveny, can you explain to us what you do in ICU and what you have seen in ICU, Michelle, please?
Yes, I work with the other two that just spoke, Dr. Edo-Ohonba and Dr. Grossman. So we've seen patients on the full spectrum of symptomatic and asymptomatic patients that are very ill and intubated, ventilated, and for long periods of time. And that's really what's been different about this pandemic, is how sick people are and get, and how rapidly they can decline and how long they can be sick. And so what I do is we run on these patients and do everything we can based on the information that we had from the beginning of the pandemic to make sure that we're providing the most recent evidence-based practice in helping them get well. And it's unfortunate that some of them nor never get back to what they were before the illness, before COVID affected them.
Okay, thank you very much. Seveny, can you share with us what you do at the ICU as a nurse practitioner and the effect you've seen this illness have done on family and friends, and how you have to pronounce people dead from this disease over the iPad with their loved ones not being there? Can you share that experience with us, please, our audience?
Absolutely. Again, as Felicia said, I am a nurse practitioner at Boone Hospital, and I do work in the ICU. I am very, very passionate about COVID-19 and about the effects it's had on the Black community, the Brown community, and really everyone. But I have to say this because when COVID first came around in the ICU, I can remember I went to take care of patients, and I literally counted all the patients that had COVID-19 in the ICU at that point. And they were mainly African-American men. And it really hit me home. I called my husband on the phone and I cried and said, this is really terrible. This is what we're seeing. And we had no idea what was happening with COVID-19. We didn't have a lot of information. And so that really hit home very deep for me. Additionally, when we started taking care of patients and I had to pronounce patients, I worked the night shift, and I had to pronounce patients on Zoom who were COVID positive, who passed away. It was the most heart-wrenching thing for me ever to have that patient pass alone without their family. Not alone in the sense that there was nobody at the bedside, but their family members could not be there to hold their hands. Yeah. For them we try to allow our patients to pass with dignity, of course, but at this time, just the heartbreak for these families to see that their loved ones were pronounced dead. I would say to them, I'm sorry, there is no more heartbeat. I'm sorry, I'll give them a time of death. It really just wreaked havoc in my heart. And I wanted to be able to educate our community and to let them know that this is real. These people are not going on vacation. They're not coming back after next year, or they're not coming back after a few months. They are gone and they will never be at the family table ever again. And so for that reason, I am very passionate and want to share with each and every one of us why it's important to be able to get the information that we need to make an informed decision on whether to get the COVID-19 vaccine.
Okay, thank you so much, Seveny. There has been a lot of media circulation, misinformation, wrong information getting in the hands of people about the speed by which this vaccine was produced. Dr. Grossman, can you speak to that for us, please? Because people are hesitating because they said it takes longer to produce a vaccine. Why this vaccine was produced in a short amount of time? Please, can you speak to that?
Yeah, absolutely. You know, I think us as you know, the general public and us as healthcare professionals, you know, we have a pandemic that lasts for a year so far. We see 3 so far incredible vaccines come out and get approved, which is much quicker than normally that we see. And honestly, normally we're not involved in the vaccine production process. You know, I have so many patients asking about the COVID vaccine and is it safe and can I trust it? And you know, I tell patients to get the flu shot every year and the pneumonia shots and the shingles vaccines, and I've never had a patient question that. And so, you know, clearly there's much more attention that's been brought to it right now. But the truth of the matter is that there are immunologists and vaccinologists who have been studying this for years and years and years. And so it kind of belittles all of their work that they've put in behind the scenes for us to say that they rushed this out over the course of a year. Coronavirus is not a new virus, and it's not a new virus that it causes pandemics. There have been, you know, not necessarily as severe a pandemic before, but you know, we've had SARS before, we've had MERS before, and so there have been people studying how to make vaccines out of that would protect against coronavirus for 10 years or longer at this point. So really what happened is when the pandemic hit, these people who have been studying this for years and years, who have made this their life work, were able to take the knowledge that they had gathered over the last 10 years and experience with the last coronavirus outbreaks and put it to use immediately, and really create incredible vaccines that are very effective, that have very little side effects, that are very safe and very well studied. And you know, all of the vaccines that are out right now, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson, all have as robust as studies behind them as any other vaccine that we're commonly recommending to our patients. Okay. So, you know, there truly is not a doubt in my mind that this is, you know, a rushed vaccine or an unsafe vaccine. You know, it came out quickly because we learned about this quickly, and because we have a pandemic coming out, and it needed to come out quickly. But the truth of the matter is that there are a lot of brilliant scientists who have been researching this for years, and were able to take their knowledge and things that they've learned and put it to use immediately.
Okay, thank you so much for that, Dr. Grossman. And again, another thing that people have been very worried about, especially the Black and Brown community, because of the mistrust, the history, long history of racism in the healthcare, with healthcare workers and healthcare system. They have been afraid because they've seen numerous times, for instance, the Henrietta, The Immortal Life of Henrietta Lacks. If anyone has read that, if you haven't read that book, please get it to read. The unethical things that was done to that Black woman. And then the 600 men from Alabama when the syphilis studies was done. Also, what can you say to that, Dr. Edo-Ohonba, please? Can you speak to that to reassure?
Yes.
We hear their fear, we hear them. We know that there's a fear and mistrust, and we want you to speak to that and allay their fears about this, please.
Thank you. Thank you once again. You know, there is definitely reasons for people to be afraid and to question things because of the history. You know, things have changed a lot. The way things are right now may not be fully perfect, but America has done a lot, has changed significantly, you know, compared to when these things happened many years ago. And more importantly, you know, at that time, you know, there are not many Blacks involved in research because of the way the system was structured. But that has significantly changed in the last in the last few years, in the sense that even the current vaccine that we are using, especially the one from Moderna, was a black woman, Kismika Corbett, I think that's her name,
Yes.
was instrumental in producing this vaccine. And if you look at all of us right here that we're introduced, we've all taken the vaccine.
Yes.
Because we know it's safe, we know it's protective, and there's no way you can separate. Because I know some of the fears that people may have is that, how do you know which one you're being given? Is it possible that they are hiding some and giving it to a different population and giving others a different population? The truth is that it's impossible at the way medicine is, because all these vials, they have lot numbers, so they are all coming out from the same factory, so it's not possible for you to separate them in a way that some go to a specific part of the world or part of the country and others a different type. So these vaccines are really, really safe. And I know along the line, we'll talk about the proof that they are safe. And we also talk about the proof that they are effective. But overall, I think, based on history, people may have reservations, but since all these things happen, there have been a lot of safe proof mechanisms that the government have put in place that makes it impossible now to experiment with humans. It's almost impossible to do that.
Yes, I was going to ask you about the IRB to speak to that, because that was put in place after all these unethical practices cropped up within the minority community population. So these institutions were put in place to prevent any such things from happening going forward. So that is what Dr. Ohonba is talking about. So thank you for that. Michelle, do you have anything that you will share that you've seen the impact of patients who are on the ventilator while you're taking care of them, and how their families could not be there for them, so that people will begin to understand that this disease is real and we need to protect ourselves. We need to wear our masks. We need to stay socially distanced, even though we have had the vaccine, because there are multiple strains out there that is coming up that we don't know about. And Dr. Grossman, feel free to jump in also after Michelle to speak to these new strains.
Yes, people, one of the things that we talked about amongst ourselves when this all was relatively new was when to place a patient on the ventilator, because studies were finding that once a patient was on the ventilator, it was going to take a long time for them to come off if they came off. And so sometimes there were patients that were on high levels of oxygen for a long time, hoping to get through the illness just to ultimately end up on a ventilator, and therefore on a prolonged course with tracheostomy and feeding tube. And unfortunately, after that, the goal is to hopefully be able to get that breathing tube out. And patients end up still needing the trach and go to a long-term hospital. And so they go for extended periods of time where family, like Seveny had mentioned, is not able to visit. They're not able to see what's going on. They're trying to understand the complex medical situation that's happening just by a phone call or a FaceTime. And I think that if I could speak to anything, I wish that it's heartbreaking really when you hear family members say, it was just one day, or we just had this one thing that we wanted to do together, or it was the grandson's birthday or graduations. I mean, there's all of these celebrations that we understand you want to share with friends or with family. But that one day landed their family member in the ICU for, X period of time, plus a long-term care facility after that. And they all many times say they don't feel like it was worth it, or they try to rationalize, and that's sad. You know, it's really important to spread the fact that it's important that you, like you said, social distance. It's important that you get this vaccine, because as this time goes on, it's been a year, people are itching to get together and to do things. And one of the best things that you can do is, at least, if nothing else, which I don't encourage nothing else, but get the vaccine, protect yourself, protect your family, and protect the community.
Okay, before Dr. Grossman, thank you so much, Michelle, for that. Before Dr. Grossman speaks about the new strains and what's going on in the other parts of the world, regarding the shutdown that is coming up again in other places, I want Seveny to speak to the fact about the effect of comorbidity that especially the African-American population have. When they come into the ICU, most of them have diabetes, hypertension, and some of them have sleep apnea, where they need CPAP to sleep at night. So can you speak to how that is compared to those other population that don't have this comorbidity and that are not disproportionately affected by the navigation of the healthcare system and the disparities that exist in this population, please?
So it's important to note that patients that have comorbidities are oftentimes more sick than, say, a healthier patient, right, who gets COVID-19. So our African-American population comes in and they are at risk for hypertension or high blood pressure. They have obesity, they are diabetic, their diabetes might be uncontrolled. They have not trusted the healthcare system to begin with. And so by the time they get to the ICU, and now with COVID-19 on top of it, we have several things that we're dealing with. We're dealing with a respiratory illness, that to include COVID-19. We're dealing with hypertension, high blood pressure. We're dealing with obesity. We're dealing with an uncontrolled diabetes patient. So this is like a recipe for disaster for this kind of patient, right? So these are the patients that we see end up on the ventilator, right? They are the patients who have all these comorbidities in addition now to a COVID-19 infection, which is very detrimental to their health, right? These patients end up on the ventilator, like Michelle talked about. After being on the ventilator for however long, if they do make it, meaning if they're not pronounced before they leave the hospital, then we're talking about long-term care. We're talking about their families having to think about, do I want mama or papa to be at a long-term care facility with a tracheostomy, with a peg tube that they're going to start getting feeding through? We're talking about overall malaise and fatigue. These patients that have this long-term effects from COVID-19, right? Now you think about, I had to take 1 or 2 medication for my high blood pressure or for my diabetes. Now you are consistently on insulin. You are now on 4 or 5 different medications. You're now on respiratory medications. You're on inhalers. You're on breathing treatments. So this becomes very problematic, and it's like a ripple effect of adding something that is preventable by simply wearing your mask, socially distance, washing your hands, and getting the correct information to be able to protect yourself from COVID-19 by getting vaccinated.
Thank you so much. Dr. Grossman, there's a question here on the chat from Jen Carpenter. She asked, I have heard that if you have had the virus and then get the vaccine, chances are high that you will feel or get sick. Is this true? Dr. Grossman, please.
Not necessarily. You know, we're seeing a lot of variable responses to the vaccine, whether you've had the virus or not. You know, when you get the vaccine, it creates an immune response, which is the goal of it. And so a lot of people will say that they had a sore arm afterwards, that maybe they felt like they had a little bit of a fever, they had some body aches, they had some chills. And that's, you know, all signs of a good immune response. There's some thought that if you've had COVID before and you get the vaccine, that you might have a little bit more of an immune response because you've been exposed to the virus before, so your immune system recognizes it a little bit more. But it's truly variable. You know, there are people who did not have COVID who have, you know, a really nice immune response after the vaccine and have some, you know, effects from the vaccine for a day or two. And there are some people, you know, who had COVID and had really severe cases and get the vaccine and feel totally fine after. So it's really variable. There's no good way of predicting it as to who will feel some side effects from it.
Okay, thank you very much for that. Can any of you two doctors talk to us about the strains, the new strains coming up and the reason why they are shutting down again in Italy and Paris and the European area, European community?
Yes. So yeah, we have to remember that viruses, they are living organisms. You know, just like how we are trying to survive, they are also smart, trying to find ways to survive. You know, the easiest way for them to survive is when they find hosts where they can live, where they can grow without we providing ourselves to them. They can't survive, you know. And so the more people are infected, the more they survive. And when they start surviving, they start changing, you know, because our bodies and our immune system are different, you know. So based on how many hosts that they keep infecting, they keep changing their strategy. They keep changing certain proteins on their surfaces to make it easier for them to infect more people, you know. So that's why there was several strains from England, you know, from even from Brazil. There's a strain from South Africa, you know, and on and on. And in fact, now there may be some strains like coming out from California, you know, and so that's just the nature of the virus, you know. But despite all these things, the great news is that most of the vaccines that have been developed so far, you know, have been shown to still have good coverage for these new strains, you know. So the fact that there are new strains shouldn't discourage us from taking the step to get vaccinated, you know. And the easiest way to arrest these strains from continuous mutation is for us to stop it from spreading. Once we stop it from spreading, either by use of mask, social distancing, and getting our shots, you know, if we don't do any of these things, then most strains will continue to evolve. But if we do that, they will be able to stop it in its track.
Okay, thank you very much for that. There has been questions about it's not enough to tell people to go get the vaccine. Where should people go? I reached out to, and then how should they register or sign up to get vaccinated? I did reach out to Cole County Health Department, and they gave us information that we will put on our Facebook, the Mid-Missouri Black Nurses Association. It gives a number for people to call, and then website to log into to register and to be able to, and there's been an announcement from the governor, Missouri governor, that from on the 9th, by 9th of April, that all Missourians should have been vaccinated. So, or rather adults, right? Can someone speak to that, Seveny, please?
So on April 9th, we will be in the phase 3 of vaccination, and all Missouri residents, it will be open for all Missouri residents to be vaccinated, whoever wants to get the vaccine. So that was recently announced.
Okay, thank you. Thank you for that, for clearing that. And again, before you can get vaccinated, whether you have insurance or not, you have the right to be vaccinated. Having no insurance does not stop anyone from getting vaccinated. When I reached out to Cole County Health Department and the Community Health Center here of Mid-Missouri in Jefferson City here, I was told by Dr. Sullivan to make sure that I let our audience know to establish care with a primary care provider. If you don't have anyone or if you don't have any insurance, call the health center. Go to any health department and sign up and request for a provider so that you will be able to get on the line to be able to get vaccinated. Those that are monitoring the Q&A for us, we have.
Can I just mention?
Yes.
That you do not need yes, ideally everyone has a healthcare provider and a primary care doctor that's looking after them. But if you don't have one right now, that doesn't get in the way of you getting a vaccine.
Thank you.
Truly, the only thing you need to do is if you have internet access, there are sites that you can go on to sign up to get the vaccine. You know, I'm more familiar with the Boone County system, and the University of Missouri has a website, and there's a COVID vaccinator website where you can sign up to get the vaccine, and they pull patients off the list. Boone County is also doing specific outreach into the Black community so that people maybe feel more comfortable getting a vaccine where they kind of trust the people. So they've already done one outreach with one of the churches in the area. And in the next 2 weeks, since we will be opening to having more people be able to get vaccinated, they have another event planned that I'll also share with the Mid-Missouri Black Nurses Association, so you can post as well, of specific outreach into the Black community to be able to help vaccinate patients. But truly, you don't need a provider. You don't need to be hooked into the system. All you need to do is to either get on a list through one of the websites or call the health department to get on the list. And as someone who has done given vaccines as well, I can tell you that it's a pretty smooth process. You know, once you're on the list, you get called and told, when it's available and when you can sign up. And it has been a pretty smooth process once you've been able to get into the list and get onto the system.
Okay, thank you for that, Dr. Grossman. Thank you very much. I have Dr. Hauk and Lita Pistono monitoring the Q&A chat, and we have some questions that I want to read out to you, please. One of them is, why is the vaccine not safe for teenagers? That is one of the questions, please.
I will quickly answer that.
Okay.
It's not that it's not safe for teenagers. As part of the testing that was done, that population was not involved in the testing. And so in medicine, what you have not used on a group of people, you cannot market that. You can't put it in the general market for everyone. So I think right now some of these companies are already doing studies involving children. So in the nearest future, I'm sure that the study will be made available, so that then we can have enough confidence to say that it's safe for those group of people.
Okay, thank you for that. For Pfizer, it's 16 years and up, and for Moderna, it's 18 years and up. Thank you for that. The second question in the Q&A is, as a Black woman, how do I confirm that I'm actually receiving one of the vaccines? Historically, we have been involved in many clinical trials unknowingly. So can any of you speak to that? We did talk about this in the beginning. Maybe she wasn't there when we talked about this. Can you take on that, Dr. Edo-Ohonba, please?
Yes. Thank you. That's a very important question, and people have reasons, especially African Americans, historically based on things that have happened in the past, but again, times are different now, like there were several things that happened, apart from just African Americans, even the Jews, they were subjected to various kinds of experiment, and based on all these historical wrongs, the various countries came together and individual institutions came, and they have very, very strict policies on how to perform experiments now, and there's something called an institutional review board, the IRB, and the composition is such that it tries to represent every strata of the society. Every people from every race will have a say. They will have an idea of what's going on. They will be involved in the whole process, so that you cannot exclude, or you cannot also try to harm any or have any. Nothing can get into the market that was specifically targeted at people of a specific race or ethnicity or gender, just to hurt them. It's almost impossible, because the steps and the hurdles that every medication, vaccine has to go through is such that that cannot happen again. So I can tell you this: you should have 100% confidence that you are not going to be involved in any experiment.
Okay. Does anyone else have anything to say? Dr. Grossman, do you have anything to add to that, please?
Yeah, sure. I absolutely agree with Dr. Edo-Ohonba. There are rules in place now. There is clearly reason for distrust. There is clearly a history of awful experimentation that was done, in the distant past, in the recent past. But truly, for any kind of experiment now, any experiment has to go through a review board. In terms of actually getting the vaccine, I volunteered at our vaccine clinic one day, and I can tell you there's no way to mess it up. There's no way to really mess with the system. I had my table in front of me. I was given little vials that had a lot number on it, and I was to pull 6 vaccines off of each one of the little vials. And someone was put in my chair, and I told them information about the vaccine. I gave them the vaccine. They moved on. The next person sat down. I pulled up the vaccine. And so it's not like there really is room for anyone to be messing with the system. The most important thing that we can impart is that, this is a safe vaccine. It protects you, it protects your family, it protects members of the community who need protecting. And the most important thing we can do is to get this vaccine in as many arms as we can.
Okay, thank you. Thank you for bringing up about volunteering. I also volunteered at the Columbia Mall at the Boone Hospital Clinic COVID-19 vaccine. And I was one of the ones who check people out and monitor for reaction in case they have reaction. And everyone goes through the same, the lot number is put in, it's from the same refrigerator, from the same cooler that the medicines are being brought out to give to both Black, brown, and white patients that walk through the door. So I can attest to that, what I've seen, and where I went to my doctor's office also to get my own COVID vaccine also. I got mine 2 or 3 weeks ago. So there's no fear to that. But talk to your primary care physician, especially if you have a history of allergic reaction and you carry EpiPen. Make sure you talk to your provider before you go get the vaccine. Another question says, I have had my first dose of Moderna. When should I expect to feel the full protection of the vaccination? Dr. Grossman?
I can answer that. So Moderna is a 2-shot series, and the vaccines are given 4 weeks apart. You know, we expect your full immunity to be 2 weeks after your second vaccine. So, you know, the first vaccine 2 weeks after, you should have pretty good protection, but your full immunity will be 2 weeks after the second vaccine.
Okay, thank you. Julia Allen asked this question: is anything being done for underserved people who are not connected with the internet or know to call to get a vaccine, the homeless or near homelessness, those who are who are working with the poor?
I can only speak for Boone County partially. I know with their outreach clinics, they are working on patients who need transportation for their outreach clinic, as well as patients who are more homebound and kind of too ill to be able to get out to get the vaccine themselves. I'm not sure about the homeless population. That's a really good question that I'm happy to bring back to them.
Okay, I will check on that and check with you, Dr. Grossman, and then we can post that on our Facebook, the Mid-Missouri Black Nurses Association Facebook. So we put up the link and we will put it up. We put the link up at the beginning of this webinar, and we will put it up again at the end for everyone to have, so that you can go there to get all this information. Whatever questions we don't have answers to, we will find out and let you know through our Facebook. Thank you for that, Dr. Grossman. Another question is thank you also for the information of the outreach to the Black community. If we can get that information, that would be okay. Sorry. Okay. Another question is this going to be a vaccination that will be required annually? Can you speak to that, Dr. Edo-Ohonba, please?
Yes. So there's a chance that maybe a booster dose may be required in the future. You know, again, it all depends on, you know, first of all, this is a relatively new illness, yes. You know, and we don't know how things are going to play out completely yet, yes. You know, but I think looking at everything right now, you know, with all these new strains that are coming up, I won't be surprised if in the future we'll require a booster dose, you know, and that will be because of these strains that are coming up, because in other parts of the world, we can already see that they are already in a fourth wave, you know, and so if they don't do something, they may get into a fifth wave. And at that time, it may be, the virus may almost become a completely new entity at that time.
Okay.
You know, yeah.
So basically what you're trying to say is that for right now, since this infection is a new infection in the community, in the pandemic, we're still learning the processes, and we're still learning everything that is doing, especially with the mutation, yes. and the new variants that are coming out. So what we are saying, or what he is basically saying, is that we will continue to learn as new information comes. We will continue to grow, and information will be available to the public if this is going to be required annually, like flu vaccines or not. We don't know that yet, because this is the first time we're having the vaccine used. So we will see how that goes. Did I
yes.
say that right? Okay, thank you very much.
I wanted to add something to that.
Okay, go on.
So we remember that vaccines are recommended, right? We're not coercing people to take the vaccine.
Yes.
Now, when our kids go to the doctor and we get vaccinated, then there are several vaccines that they get 2 or 3 doses of that vaccine, right? So we get the first vaccine, and then we get what's called a booster.
Yes.
Right. And so the booster helps with, gives us a high level of immunity. Yes. Now, with COVID-19, the fact that it's a new virus and we don't have all the information about it, it is quite possible that in the future, we might have to get another booster shot in order to keep up that immunity. But again, we have scientists that are working and finding out this information for us. so that we are able to make informed decisions. Again, we do the research, we get all our information before we make that decision. I don't think anything will be required of us. Things are just recommended for the safety of you, your family, and the general public.
Thank you so much, Seveny, for clarifying that for us. Thank you. Another question is, do we know where researchers are at with determining if these vaccines are safe for children? Do we know at what point in the research that they are at right now? Do we know that, please?
Yeah, there's at least three ongoing trials right now. So the main vaccines that have been released for adults are all currently actively investigating the vaccine in children. So I think Johnson & Johnson is the only one that's still actively enrolling. There's no site around here. I looked, but Pfizer and Moderna both are closed right now because they have actively recruited kids to be in the vaccine studies.
Okay, thank you for that. And then there's another question. The information about the vaccines that is being shared states the vaccine are unapproved. Earlier, it was stated that they are. How can the public feel safe when the information is conflicting? This question is from Phyllis Wilkerson.
Yes. Again, first of all, this because of right from the beginning, there were so many misinformation about the disease, and then unfortunately it became a political disease, and I think the politics of the disease was worse than the impact of the disease itself. And in fact, the politics of the disease actually made the disease to be more deadly. Things like social distancing, face mask became a political statement. So right from the beginning, I think we got it wrong, and so that allowed a vacuum whereby there was a lot of misinformation, not only about the nature of the disease, how the disease came to be. These were all, so there's so many stories, some linked it to like 5G and so many other strange theories, but the truth is that, at every step or and every stage, there have been misinformation, and the fact that people will send you information does not make them accurate, but the accurate information, you can go to the CDC website, you can go to government accredited websites, even hospital website, Boone County website to get more information, but the truth is that the vaccines are safe and they will help us. If we are going to get back the kind of life that we used to know, then we all have to do our best, and we all have to do what we have to do to get back our life.
Okay, thank you very much for that. There's another.
Can I add something to that?
Okay, go on ahead.
So piggybacking off of what Dr. Edo-Ohonba said, the vaccine, the hesitancy, the fear, all the misinformation, it was rampant, and we continue to see that on social media. Now, I have to be very honest with all the viewers on this platform, because as a healthcare provider, I was also hesitant to take the vaccine. I had a lot of issues to take the vaccine, but after reading and doing my own research and knowing how science works, that gave me confidence in taking the vaccine. Because even though there was a political element to it, I saw these patients in real life. I saw patients die. I knew that these patients were never coming back. And so for me, doing my own research, being on the front lines and seeing all of this happening in real time, right, made me really realize that we have to kind of shut off sometimes the misinformation that is out there, really, because tomorrow, grandpa is not going to be here, right? Grandpa will never be here. He's gone, and he's gone forever. So we have to get information from reputable sources, the CDC, the FDA. The FDA would never approve something that was never safe for the entire population to consume.
Yes.
So I think it has to do with a lot of the misinformation out there, rightly so, for people to get hesitant.
Okay, thank you for that. Before I ask the next question, I want Lita, please, to add Dr. Martha Dawson to the panelists. She is the national president for National Black Nurses Association. I saw that she is here, so I would like her to be added to the panel in case she has anything to add to what we're discussing. And thank you so much, Dr. Martha Dawson, for your support, for being here with us this evening. Thank you. So the next question would be, how concerned should I be after I am fully vaccinated and I live, work in an environment where others are not vaccinated? Dr. Grossman?
It's a very good question. You know, the CDC recently released kind of guidance on how to re-enter the world once you're vaccinated. And I think it's really good guidance. It's very fair guidance. You know, and they say that you know, if you're fully vaccinated, you should feel comfortable interacting with other people who are fully vaccinated. And you know, as someone who personally hadn't seen my parents in 15 months, and got to visit with them last weekend, now that we're all fully vaccinated, it was incredible being able to hug them and interact with them and feel some sense of normalcy again. The difficulty is if other people around us aren't taking the same steps to protect us and to protect their community and to protect themselves. And so we don't fully know that yet. You know, we know that the vaccine is very protective once you've taken it. We know that the safest thing is for everyone to take it and for us to build up a herd immunity where we really aren't, you know, even exposed to it. You know, right now, if you are vaccinated, you know, and you get exposed to COVID, we don't really know if you could become, you know, you could actually get the virus and be a carrier and expose someone else. We think that chance is much less because the decreased amount of virus that's able to replicate in your body. But we really don't know all of these answers. And because of that, and because we don't have everyone jumping on board and being vaccinated, and because we aren't close to having herd immunity yet, the recommendation still is to wear your masks, to maintain social distancing, to do good hand hygiene, and to really try and stay as safe as possible, especially if you're around other people who are unvaccinated. And for them to take those same precautions, you know, especially since they're the ones who are unvaccinated. Okay. And I think, you know, part of the reason that we all feel so strongly about talking about this and about talking to the community about this is, you know, that we're hoping that we dispel some of the myths that are out there, that we contribute to a good education campaign and convince you that you know, this is good science and this is good for our bodies, it's good for our health, it's good for anyone who's around us, and it's good for our communities. Yes. And so our hope in talking to you all is that each of you take this information and bring it to your family and bring it to your community and bring it to your workplace where people might not be as safe, and really try and spread the word that this is really what's going to get us back to some sense of normalcy.
Okay, thank you very much, Dr. Grossman. Before we wrap up with all of you summarizing tonight's event, and before I let Dr. Martha Dawson speak to this event, I will like to introduce my Vice President of the Mid-Missouri Black Nurses Association. Lita, can you put Lena Mahani on the panel, because she is an LPN that has a sister who is a nurse. She went through the COVID, she had the infection, experienced it firsthand, and is vaccinated right now. I want, if Lena is here somewhere, Lena Mahani, to share her experience of what she went through and what it was like to not be able to breathe. Thank you, Lena.
Good evening, everyone.
Good evening.
It's an honor to be here tonight. I was diagnosed with COVID in November.
How did you find out that you have it, please?
I found out that I had it because I was having difficulty, an unusual amount of difficulty breathing, and I developed a high fever, which I never have, because my body temperature always runs low. So I called my physician right away and told him that I was having this fever and body aches, and he suggested that I get a COVID test. So I went right away and got the COVID test, and that was on a Thursday. And he called me on Sunday evening and told me that I had COVID and he wanted me to go to the hospital. And so he said it was my decision. I told him that I did not want to go to the hospital. I would take my chances at home. And was there anything else that he wanted me to do? And he said, well, we can put you on high dose steroids because I am a diabetic. I do have asthma and I have congestive heart failure.
So why did you choose to remain at home with all these comorbidities?
I decided to stay at home because I felt that I would be safer at home because I have a sister that's an RN and she worked with COVID patients and she brought the same treatment to me that she was given to her patients at the hospital. I set an alarm on my phone. I turned myself in bed every 2 hours from side to side into my stomach. I took breathing treatments every 4 hours. I had a pulse oximetry to measure my oxygen level so that I could see that I was not losing too much oxygen. And sometimes my oxygen would get down to 88, 86%, but I would recover once it would only do that when I got up moving around. But once I got back into the chair or in the bed, it would go back to 94, 95%. So I knew what to look for.
Okay.
And I knew if it stayed there, I was going to have to go. I didn't have a choice.
Okay.
But my sister was here every day checking on me.
Okay, you told us, sorry to cut in, you told us about, I apologize for interrupting, but I want this to the audience to hear. You told us you were so scared that you couldn't get to the bathroom. Can you explain what that feels like?
Yes, it was very frightening the first week because I had a hard time breathing, just walking from my bedroom to the bathroom because I would get so short of breath every time that I got up. It was like it was like something was inside of me, sucking my air out of me. And I would have to hurry up and get back to the bed so that I could get another breathing treatment to help with my breathing.
Okay.
It was like every time I moved, it was like something was just sucking the wind out of me that I couldn't get air.
Okay. Where did you think you got that from? And will you explain when you got your vaccine, if you had any symptoms or reaction afterwards, please?
I believe that I got COVID from my grandson because I don't go anywhere. And I have a 14-year-old grandson that plays basketball, plays football, and he goes everywhere. And he has spent the weekend with me prior. And then I started feeling sick on Tuesday. And then I really got sick on Wednesday. So I felt like that's where it came from, that he was the carrier because I don't go anywhere.
Okay. The reason why I asked this question is to make it clear to our audience that it's not enough when you're not going out or anywhere to protect yourself or others, but also when you have family members who are out and about, you limit contact with them and make sure you social distance and make sure you wear your mask. So Lina, continue and finish up for us how you got your vaccine and any side effects that you had, please.
Okay, I got my first vaccine, and the first day I did not have any symptoms, but the second day I had just some like cold chills, kind of body aches, but I took some Tylenol, but I haven't had anything since.
Okay. Thank you very much for sharing that. And I would like to use this opportunity to ask Dr. Martha Dawson to speak to the fears that people are having in our community, to reassure them and say whatever you feel like contributing to this webinar tonight, please.
Thank you for the invite and good afternoon, everyone. I'd like to, first of all, thank my Mid-Missouri colleagues, leadership team, and all of the members for putting on this great workshop tonight. And I'd really like to thank the two guests that are here with you all. I appreciate the valuable information that I was able to hear from you all. I apologize I could not be here at the beginning. That's because I was working with a chapter that is in the process of collaborating with some physicians to start going into the rural area of their state. Okay. So I just have, my hat is off to nurses, first of all, yes, and all of the other medical personnel, because we would not be here today if it was not for what you all are doing on the front line, for all of the scientists that are in the lab that have done the work, and for the physicians that are out there also on the front line. I was listening to, I think it was one of the physicians sharing this story about seeing patient die and having to move the needle in terms of their own acceptance of this. And I will say to you that, yes, I've had both of my vaccines. I was vaccinated with the Pfizer vaccine, and I just last week on the 11th received my second dose. And I was sharing with a colleague, I said, maybe I'm just a little stranger than everyone else. My first dose, I had just a mild sore arm, not much of anything. The second one, I didn't feel anything. My arm didn't even get sore. As a matter of fact, I felt so good afterward. I went for a walk that evening in my community. Of course, no one was out there but me, but it was a nice sunny day. And I didn't go that far, but I did go for a walk. But I have to just say, I had no side effects, no chills, no fever, no anything. So I'm glad that I took it. And one of the things that I'm now concerned about is that when I'm hearing so many of my nursing colleagues say that they will not take the vaccination. And I just listened to the story of our member talking about her experience. And for those of us that are still going around patient, we need to protect ourselves. Because I know that we, within the MBNA, we have had nurses who have passed. We've had nurses, spouses to pass. We've had some of our members' children that have passed. And one of our members that was in South Carolina, she lost her daughter first, and then she passed. So this is something that we have to take to heart, and we have to lean in and lead the way as nurses. And I've also been talking to those individuals that are in the nursing home and the long-term care facilities. And I've had to be very frank with some of them to say, your patients are already quarantined in. So you don't have a nursing home patient going out into the public or socializing to capture this virus. If they're getting the virus, it's coming from someone bringing it in. Either the administrators, the caregivers, or their families. They deserve better protection from us as healthcare workers. We should never be taking it lightly that, yes, the patient has been now in many of the nursing homes, they've received the vaccination, they've been vaccinated. But when I hear that there's a nursing home person saying, but I don't want to take the vaccination, I'm saying, then you are exposing the very people that are providing for your livelihood. In these times such as this, we have to have critical and crucial conversations. And some people say, well, you sound as if you're trying to make them guilty. I said, no, I'm trying to make them responsible. Because if that was my mother that was in a nursing home, I would want someone protecting her. If you are my patient, I want to protect you the same as I want you to protect me. So we have to be the one to lead the way at this time. And I think sections such as these, where we're educated, that is extremely important. And I just want to say that I'm so proud of the members of the National Black Nursing Association. I received a letter just on yesterday from the president out in San Diego, and she was telling me, and has sent about 4 different videos where they within a week had vaccinated 1,000 patients. To think that nurses are stepping up to the plate and reaching out in their community and doing these type of things, this is what it's all about if we're going to get over this. When we talk about the herd immunity, that means that every person that can take the vaccine and do so safely, we need to be, stepping up to the plate and being that example at this time. I too will share that. Yes, I have high blood pressure and I'm also a diabetic. And I'm not overweight, any of that, but I still have those 2 pre-existing conditions. And so, yes, I had to think and consider for myself, am I going to take this? And when I started telling my family, yes, I am going to take it, because when I look at the stats and I look at the odds, when we're talking about 1 in 5 people just a couple of months ago were dying who contacted COVID, my risk factor was there. And hopefully I got good genes, but I would tell you, I'm in the older population, okay? So that was another reason. I was in that age group where I could step up and take it, so I took it, So I would just say thank you again to all of the presenters and the ones that I was able to hear. Great information, keep helping us to get the word out. If you can talk to your faith-based organization, if you can be on the radio, push it out. Because this is a time that we have to be able to trust science. And again, I appreciate all of the expertise that the physician brought to the table tonight to be able to clearly speak to the scientific aspect about how the vaccine was developed, the safety of the vaccine. And we are in this together. But if we want to see this time next year, we have to continue to do the work that we're doing. So again, thank you so much for allowing me to speak. And I was delighted to be able to sit in on the part that I was able to hear. Wonderful, great job.
Thank you, Dr. Martha Dawson, our president, our National Black Nurses Association president. Thank you so much for that. Okay, before we end tonight, I would want the panelists to go around and speak and summarize what they would. If there's one thing you would like the audience to take away from tonight, what would that be? Let me start with Seveny, please.
So if you guys take away anything from our discussion tonight, for me personally, I want to ensure that we all can have a summer. We all can, whether it's barbecues that we're going to have this summer, or whether it's going to see your family that you've not seen in however many months since the pandemic came about, whatever it is that you want to do. Maybe it's sending your kids back to school, right? My kids have been doing virtual all this time. Maybe it's going to, the beach, whatever it is. The only way to get back to normal is for us to all get protected, and we're going to protect ourselves and we're going to protect our family. So get all the relevant information that you need that will help you to make that decision to get vaccinated. It is a personal decision. We want you to get vaccinated, and also we want you to remember, continue to wear your mask, continue to socially distance, continue to wash your hands, and live and love each other.
Thank you for that, Seveny. Dr. Grossman.
So hard to follow that. I would say, you know, the thing that really strikes me about this is, you know, especially, you know, talking about outreach to communities that are most affected. You know, in the Black community, we know that the Black community has been disproportionately affected by COVID. We know that they've been disproportionately affected by severe COVID. And we know that there's a history of mistrust, a very rightful history of mistrust. And so, you know, the concern for me is that if we really can't build trust in the Black community and other minority communities, that this is a good vaccine, that this is a safe vaccine, that this is going to protect you and your family, then we have a community that's more at risk to get incredibly sick from this disease, and more at risk to not take the vaccine that could protect them and their family. And so I couldn't feel more strongly about this, that you know, this is education that we need to get out there so that we protect the communities that need protected.
Thank you so much, Dr. Grossman. Michelle?
Unmute myself there. I just want to piggyback a little bit on what both of them, Seveny and Dr. Grossman, talked about. With all of the misinformation that's out there, I'm happy that everyone was able to be a part of this webinar and see that there is, despite what there was in the beginning, there is a wealth of information and resources that people can go to get the information that they need to denounce some of all of the concerns and the questions that they have, so that they can make the best decisions for themselves, which hopefully is to get the vaccine, but also to discourage people from listening to the wrong information and the wrong outlets, because there are places that they can go, and maybe pointing them in the direction of where to go to get their questions answered, because it is reasonable to have concerns. It's reasonable to be a little bit weary, and the only way to really make yourself feel better about your decision and know that you're making the right one for you is to get it from not your neighbor or your friend, but from a reputable source of information. And I feel like this has been a great panel that has been able to spread some, but everybody will be able to go to the website and see the links that you guys mentioned earlier to get the rest of their questions answered.
Thank you very much for that. Dr. Edo-Ohonba, please. What you would
yes.
like people to take away from tonight's webinar, please.
Yes. Thank you all for participating. So, you know, what was very, very interesting, or strange rather, about this disease is that there were people who had certain risk factors, and we thought that they were the ones who would die. Like if you had diabetes, if you're older age, if you had hypertension, you know. But the truth was that there were several people who had these conditions and they survived, a lot of them.
Yes.
And what was even more interesting was that there were several people who did not have any of these risk factors and they died.
Yes.
So what does that mean? What this simply means is that what we know, we can predict what the vaccine can do to your body. But one thing we couldn't predict is what the disease will do to your body. So please get the vaccine, get vaccinated, because whatever side effects, we can predict that. But if you get the infection, no one knows what's going to happen.
Okay.
Thank you.
Thank you so much. Right now, I have the poll up to say, was the webinar helpful? Yes or no? I will launch the poll so that people can fill in what they think about the webinar, and then we can give the result. Wow. The result is out. 100% said yes, that the webinar was very helpful. So I am so glad. And this is just the first of many series to come. Next month, stay tuned. we are planning to have another webinar, and that will be mental wellness and COVID-19 pandemic. So when we put that together, we will spread the information again, and it will be on our Facebook. And we are thinking of 2 dates, either 23rd or 30th of April. And these are the 2 dates we're playing with right now that will, when we have panelists that would work with us on this, then we will confirm the dates and share the information. So with that said, I thank all of you, Dr. Edo-Ohonba, Dr. Grossman, Michelle Gay, Seveny, Grieve, and Lena, and Dr. Martha Dawson. I thank all of you. I thank Dr. Noreen Hauk, who is my boss at Stevens College. I thank Stevens College and Boone Hospital partnership. We have a new nursing program, which I am an assistant professor in a new nursing program that we have direct entry to, BSN, and we are in partnership with Boone Hospital, and these panelists are all from Boone Hospital. And we have the support of Stevens College backing us up for this webinar. So I thank you all for being here, and I thank all our audience for attending and for your participation and for your questions. Thank you all. And have a good night.
Thank you.
Thank you.
Good job.